Good afternoon. Welcome to NHS Western Isles Annual Review in public for the year 24-25. I'd like to extend a warm welcome to those members of the public who are in the auditorium and for those people who are attending online. I'd just like to give some housekeeping out just now. There are no fire alarms due today. We have 3 fire exits, one on either side of this main stage and one through the door that you came into this afternoon. And the toilets are located out the main door and to the left. I'd like to just outline the process of taking questions. It's important to be aware that we will take questions if there is time, but we will not discuss personal questions around patient care or services. We do have a structured process in which the members of the public can actually raise concerns of that nature. It's also important to be aware that those questions that were previously submitted will get a response within 8 weeks. So I'd like to thank those members of the public who did submit questions previously, and we will get back to you within the 8-week time frame. So, welcome to our public annual review. This is a yearly event, and the process for questions has been outlined, and there are 2 of us leading this annual review. Myself, Gillian McCannon, who is the Chair of NHS Western Isles Health Board, and Mr. Gordon Jameson, who is the Chief Executive of NHS Health Board. Meet the team. There's me, Gillian McCannon, and there's Mr. Jameson. We all have very similar responsibilities. I'm responsible, as you can see there, is accountable to the Cabinet Secretary for the overall vision, leadership and governance of the Health Board. And the Chief Executive is accountable to Scottish Government for the day-to-day running and delivery of strategic direction set by Scottish Government and by the Health Board. So, the 2 roles complement each other, and so does the board. So, meet the board. You will see there, those are our executive team members. We have a Director of Finance, a Medical Director, a Director of Human Resource and Workforce Development, a Director of Public Health, and a Nurse Director and Chief Operating Officer. All these board members, all the executive team lead the operational delivery of the organisation and are critical to the success and the management of that process. They are also supported by a team of non-executive directors. And non-executive directors have a key role in governance, assurance and scrutiny. They represent the local community in which they live, and therefore there is good representation of the skills and expertise within our community. They work hand in hand as one whole team between the executive directors and the non-executive directors. So, today is about our annual review process. It's a chance for us to outline the progress made in our performance in line with national and local priorities in delivery of services to the Western Isles. It's also good for us to provide assurance to the Scottish Government for our delivery of our service against national trajectory targets, and review the services that NHS Western Isles deliver to our population. Through the rest of the presentation, you will see that there are lots of services that have been developed with support from our staff, who are absolutely critical to the success of that. It's also important to outline the key challenges that Western Isles has faced and to identify the innovation that has been implemented and the achievements that have occurred by the staff who support our organisation. It's important as well to give a strategic overview of the context in which we actually deliver a complex service to our people of the islands. And in that, we look at short, medium and long-term planning. In terms of Health and Social Care Service Renewal Framework, these are now a 10-year plan. And when you see the actual strategic documents identified on the screen just now, you will see that actually they all complement, or they will complement each other. The Health and Social Care Renewal Framework is a 10-year long-term plan. There are 5 principles of change within this policy. One is around our prevention principle, and that's about preventing disease. Also, the people principle. This is around having care designed around people. Community principle is around moving care from hospital into the community. And the population principle, whole population planning. And finally, digital principle. This is around technology. These principles are not new to us. We strive to actually achieve these ambitions that are set to us from Scottish Government, and also to provide the best services that we can for the people of the islands. However, in order to actually develop a long-term plan, it's key to have some guidance around these areas that we need to focus on. The next one is the NHS Operational Improvement Plan, and this is short-term. This is actually dealing with immediate problems and immediate issues. So, improving access to treatment, shifting the balance of care from hospital and community. This is not a new phenomenon. It's something that the NHS has been striving for a number of years. Improving access to health and social care system, and prevention, working with people to prevent illness, to manage long-term conditions. The ambition is to have people living longer without being in ill health, and that's a critical move from how the NHS has previously occupied. Finally, the one that actually is an overarching principle in terms of how we develop this, the services that we planned, is around population health framework. And this is, again, is a long-term ambition. It's around a prevention-focused system. Inherently, the NHS has always looked at an illness model, i.e. people come to us when they're ill. That is an important premise to change. We need to try and help people to become well before they become ill, so they're able to manage the conditions. It's around having a Scotland where people live longer and healthier and more fulfilling lives, and that is a key ambition of the NHS going forward. And hopefully you will see from our presentation today that some of this is already in action. And finally, the final one is around Scotland's public service reform. And this is really about having joined up services and actually having an efficient system in which to operate. It's fair to say that none of these policy directives or our strategic direction can actually work in a single entity. It has to be a collaborative effect, and it has to be all linked to those key documents. So for this review, one of the areas we're going to look at in the presentation by Mr. Jameson is around our specific areas of performance. And these are national and also local priorities. And they're also related to the trajectory targets that I mentioned early on in my opening speech. It's important that we have good financial performance and good prudence around public finance. We also have invested heavily in capital investment programme, and you'll see that showcased in the rest of the afternoon. Workforce and staff wellbeing is a critical factor for us, and it's an area where we have spent quite considerable time in supporting staff wellbeing, but also recognising the invaluable contribution that our members of the staff give to us, and also to the services that we develop. It's also about the quality of the care that we do and patient safety. And part of that is also linked to our education and training. NHS Western Isles wants to be the best that we can be and to deliver the best care that we can within the resources that we have. But it's also about achievements and celebrations, which there have been many. Often we don't see what goes on in the background. We have staff on a day-to-day basis who actually keep our services going and actually provide an excellent service to the people of the islands. So I'd like to pass you on now to Mr. Gordon Jameson, Chief Executive, who will then take you through our performance, and I hope you find the rest of the presentation interesting. I will come back at the end of the meeting to close and take any questions. Thank you. Gordon.
Okay, thanks. So what I'm going to do, first of all, as Jill's already outlined, I mean, our primary focus as a health board is to improve the health and well-being of the population, and illness prevention and health promotion are at the forefront of what we do as a health board. What I'm outlining here, for those of you that are not familiar, is really the makeup of our services. And you'll see there that we've got hospitals. We've got the one here in Stornoway, which is an acute rural general hospital. We've got 2 community hospitals that you'll be familiar with in Benbecula and on Barra, 2 opticians, 7 independent GP practices and 2 GP practices which are managed by the health board. They're known as 2C practices. Dental services here in Lewis, again in Benbecula at the Euston Barra Hospital and on Barra itself. And, you know, we've got 3 community pharmacists and GPs dispense medication as well. One of the important features for us as a health board is that being an island healthcare system, you can't be self-sufficient, neither can you provide every service that patients need. So we've got a number, at least 7 agreements with other mainland boards to provide services. In fact, our reach is much, much further than that. We've got agreements and staff that come to provide services from the rest of the UK, and we've got some international links. We have, in fact, some services that link in to the States as well. So as a board working, serving an island population, you suddenly realise and know that you have to form relationships with other boards to serve the people well. I mean, what we'll see as we move forward is that Scotland's now doing a lot of work on a national basis, so certain things will be done in Scotland for the whole population of Scotland. And also we're moving now to a new arrangement which is called subnational working, where Scotland's been divided into East and West, and we sit in the West subnational group. So the reason for mentioning these things is that as we move forward, you'll see significantly more collaboration between health boards and certainly much more joint working so that patients get the right care in the right place. Just workforce, Jill has mentioned workforce. I mean, our service is delivered through our staff. Yes, we have a lot of technology, but healthcare is a human-to-human interaction, and thankfully remains so in a number of areas. So staff are extremely important. And before I go into the content of the slide, I just want to thank all our staff across all our services for their contribution, commitment and achievements that they have managed to make during this year period. It was only last week that we were celebrating with staff those who had worked 30 plus, 40 plus and 50 plus years for us. And that for me speaks volumes about the dedication and commitment that individuals have to the local service. In terms of this review, what we measure, we do look at absence rates, we look at the health of staff, and Jill has mentioned the very important work that we do on staff well-being. But in terms of performance, we're expected to have no more than 4% absence rate across the year. And that's quite a tough target to meet. We achieved 5.59 during that period. So we were above the target, but 5.59, given the services and the demands on our staff that we make, I don't think is a particularly bad performance. We recruit just now, we recruit every single day we're out to recruitment. We've got a number of opportunities and vacancies for staff, and during that period we advertised 404 posts, which is quite a busy period for our recruitment team and people that are trying to get new people to want to come and live and work and stay in the Western Isles. So always busy in terms of recruitment. We're always trying to encourage youngsters that are born and brought up and educated here to stay. And we're continuously training to ensure that staff are confident and comfortable in the roles that they undertake. Just moving on to the performance objectives, what these are. So our main objectives are to deliver safe and effective and reliable care. And that's really, really important, again, when you're an island healthcare system. You can't, I used to work on the mainland where there were other hospitals within 10 miles, 20 miles, 50 miles. When you're delivering an island healthcare system, there are no hospitals or neighbouring health facilities that can bail you out if it gets a bit difficult or it gets very busy. So we learn very quickly and have learned to become self-reliant, very flexible and adaptable. We do want to deliver care close to people's homes or, in fact, in their homes. Health promotion and illness prevention, I've mentioned, they're really key drivers for us. If we don't succeed in both of these, we will just continually carry the burden of what happens if you don't get these things right. We want to drive down waiting times. It's important for anybody waiting for any diagnostic intervention or care or surgery that we drive down waiting times to the minimum. It's really important for us as well that the facilities that our staff work with and that allow them to deliver the best care to patients are constantly being improved. So we're always taking steps to improve and spending capital funds on the environment and the infrastructure. We have a statutory obligation to meet our financial obligations, and that simply means you live within the money that the government gives you. You don't overspend, you don't borrow. It's kind of no different from your weekly housekeeping or your monthly existence. You have to work within the money you've got. And that is a challenge year on year to do that, but we have managed to do that for 17 years in a row, and that is a unique achievement across the NHS in Scotland. And we do plan, and increasingly now we're having to design services across Scotland and here in the Western Isles that are based on population health needs assessment. So resources are tight and we can't do everything everywhere, so it's really important that we understand what the core health needs of the population are and that we develop services in response to that. Just to take you into some of the targets that we have. So everybody will recognise that cancer diagnosis and cancer treatment are extremely important, and they remain a top priority for the Scottish Government and indeed for us here in the Western Isles. So we're measured there, and there's two measures. There's a 31-day target, which is the target to really get you to the point of diagnosis. And most of that is done locally. Not all, but most of it. And we achieved 100% in that target for this period. The second part of that is a 62-day target, within which time you should have started treatment following a diagnosis and an agreement and a plan. This is where a number of patients need to go off island for specialist interventions that we don't do, the specialist surgery or interventions that would be required. And our performance there was 67% against a target of 95%. Thankfully, we are talking about small numbers, but one patient not meeting that second target can change the percentages by 9 or 11%. But nevertheless, we keep working with our partner boards to try, and they too are trying to drive down any waiting times for that second part of the cancer pathway. The 12-week treatment time guarantee, that is if you're requiring surgery, then we want that wait, as I say, kept to a minimum. We have had some challenges during the period with the ability to move people around, the ability to get staff here to carry out and deliver services, and we achieved just over 77% against a target of 95%. So again, we can do and will do better in that area. Relative to the rest of Scotland, that our waiting times are far, far shorter than anywhere else. But you don't rest on that. Your objective and our duty is to reduce the wait as far as we can. The next one's new outpatient appointments over 12 and 16 weeks. And you'll see there again, we achieved just over 73% for the 12-week and 78% for the 16-week target. And constantly reviewing again how we can drive these percentages up. We're also measured on, it's not on the slide, but we're also measured on key diagnostic tests. So if people are waiting for endoscopy, colonoscopy, cystoscopy, CT, MRI, barium studies or ultrasound, then they measure how quickly we can provide that. And within 6 weeks, anybody waiting for these diagnostic interventions, 81% of people have received them within 6 weeks. Just moving on again into some other targets, very, very important areas. Access to psychological therapies, really, really important. The health and well-being of the population. And we do see more stress-related and mental health-related presentations. So it's really key for us to make sure that people can get access to services as quickly as possible. And again, there we're at 79% against a target of 90. So room for improvement there, but again, it's relative to Scotland, it's a good performance. We have services for those that have substance misuse, whether that's drugs or alcohol. We are definitely seeing a fairly significant increase across the Outer Hebrides in drug misuse. And there is an alcohol and drug partnership that oversees the services and the allocation of resources to try and reduce any dependence on drugs and or alcohol. And the access then, it's the referral to treatment time then is 88% against a target of 90. So quite close there. It is very important that people that need that kind of support get it right when they need it, because otherwise you miss the opportunity and they might relapse, and therefore it's important to support them as quickly as possible. Child and adolescent mental health services, our CAM services, again, are really, really important to make sure our young people are fully supported when they are experiencing challenges in life and mental health conditions. And we achieved 100% there of people that are seen within the required time. Dementia is an area where we do expect to see more and more and more of the population. As the population gets older, then we know that the numbers of people with dementia, it's going to increase. So there we need to do significantly better. We've had quite challenging times, and in fact still today have challenges in recruiting specialist staff into that area of dementia, particularly giving people post-diagnostic support once it's been agreed that actually they have got and diagnosed that they have got dementia. So we need to give post-diagnostic support to these people, and you'll see that we are actually well short of that target at the minute, and that's probably one of the standout areas where we need to do significantly better. Early access to antenatal services, it's really important again. We do have a falling birth rate, but it's really important that when people are pregnant and are going to go through that hopefully happy time, that they get access to the services, and we're achieving well above the target there, as you'll see. In vitro fertilisation, that's a service that's delivered, I think it's still through Dundee for us, where people require assisted conception, and again we've achieved, we've exceeded the target there. It's 100% of people receiving that service within the required time, and that's really, really important for people that are in that position, so it's good to see that. Smoking cessation, you know, all that we do in terms of illness prevention and health promotion, it's all to do with the big killers of stroke, heart disease, cancer. And smoking, of course, as we know, is very much responsible for a lot of the illness that then follows. So encouraging people and supporting people to stop smoking has always been important to us, and has always been an objective for 10, 20 more years in the NHS. So we're doing reasonably well there in terms of helping people to stop smoking. And it's measured if they've stopped for 8 weeks. So, you know, we do support people to stop and then follow it up to make sure that actually they're managing to stay not smoking. Healthcare associated infection is something that we measure, and you know, we're very focused on a daily basis on infection prevention and control. We were before the pandemic, we're even more so after the pandemic, and our hospitals are so busy just now that we have to be focused every single day on how we prevent the spread of infection. And we're above for a couple of the ones that are mentioned there, so Staphylococcus aureus bacteremia, known as MRSA, in hospitals. We are, you know, we measure that on a regular basis, and another one called Clostridium difficile, which we measure as well. We've seen more cases than that. As you can see, it's 11.41 against 3.4. But our infection prevention and control staff, and indeed all our staff, are focused on that on a daily basis, and we have surveillance which is ongoing in all areas that relate to infection prevention and control. Another important target, I'm sure if you've spent much time listening to the news over the years, you'll hear about ambulance waits outside hospitals and people not being able to get into emergency departments. You don't experience that here. Our emergency department, the maximum wait is 4 hours, and we've achieved over the target 95% against what is a national 95% target. And that's not to say we don't have challenges or busy periods in the emergency department. So, you know, very pleased that people needing immediate attention receive that here. We do, as I said earlier on, continually improve equipment and services, and I'll come on to give you some examples of what we've done to improve the services and the buildings and the equipment that we use to provide care for you. One of the areas that is developing quite rapidly is the area of developing safe and effective alternatives to hospital admission. Coming into hospital is not the answer for a lot of people, and we've spent a lot of time working on unscheduled care, that's unplanned care, and when people contact that service, we've got a range of options that might support them at home and prevent them having to come in to the service. And as I said earlier on, we have to deliver all care and services within budget, and each year we have to deliver a level of efficiency savings, which I'll come on to. So our budget in terms of, you know, if we look at our financial achievement, as I said to you earlier on, it's 17 years in a row that we've managed to live within that budget that we have. And also, you know, we've got to live within our capital expenditure. So we get money for delivering services, and we get money for buildings, infrastructure and equipment. And it's really, really important, and we do continually improve what we spend capital on. The capital itself for the period in question here was just over 3.9 million that we had in that year to improve services. It is a challenge to live within the overall budget, but it's all thanks to the efforts of staff across the organisation that we've managed to do that for a significant number of years now. Going on to the capital, what have we done with that? So it's all sorts of things that we do every year to try and improve the services that you may or may not require. So we've replaced dental chairs in the dental surgery in St Brendan's Hospital. It's really, really important that it's modern equipment, particularly for dentistry. We've brought in automatic medicine cabinets. You might say, what's an automatic medicine cabinet? Safely delivering drugs and controlling the delivery. We've brought in these cabinets in all our hospitals. Anti-ligature work is important to us for those patients that have mental health presentations and in fact may reach a point in their life where they are considering taking their own life. So we have to have facilities where these people can be cared for quickly and effectively, but environments that are safe. So we've done a very substantial piece of work in our acute psychiatric unit here in the Western Isles Hospital, and we've made the rooms and the associated facilities there as ligature free as we possibly can, and that work is finished. IT infrastructure is really important to us, so we're constantly developing. The health service is going to go forward heavily investing in digital technology, heavily investing in individuals in the community having access to their own records, being able to book their own appointments, being able to see their own results. All of that is going to take a wee bit of time, but we have to invest in IT infrastructure or we'll be left behind in that. We've bought new monitoring equipment for our theatre. We've bought new ECG equipment for use in Barra Hospital. And on the end of that list there, something that's really important. Hospitals have food waste, as you can expect, as you can imagine. And therefore we've bought in a food dryer waste unit that will allow us to be a bit more environmentally friendly in terms of what we do with food waste. Going on to one or two other areas, it's really important as the population is ageing, and it is ageing. The over 75, I think we're probably the highest increase that's likely to be seen in Scotland. And it's important then that we can support people, keep them healthy, and bone density, what's known as DEXA scanning, you may have heard of. We have a service here for that. We've replaced the DEXA scanner this year, and we're the first health board to bring in a particular type of scanning, which is called a trabecular bone score it gives, which is different. Traditional DEXA scanning looks at the bone mineral density, I believe, but our new one looks at the microarchitecture of the bone, which I'm led to believe allows you to identify if somebody's more at risk of fracture. In Euston Barra Hospital, we took the opportunity to upgrade their X-ray equipment. It's very important that they can undertake radiology, and that was a significant investment and a much better system for patients in terms of their access to the equipment. One of our biggest changes was a modernisation of the emergency department here in the Western Isles Hospital. You may have had the chance to go and see that before it opened. Hopefully you haven't had the chance to go and see it since it opened. But that was a very, very significant improvement for us. We had to expand the facilities and improve them. And we spent about 650,000 on that modernisation. We've done that because looking ahead, you're all probably aware of the significant developments that are going to come to the Western Isles between 2026 and 2030, the significant increase in workers that we're going to see, the significant construction all over that's going to go on, and it's going to go on for a number of years. So we took the step of, as I say, modernising and increasing the capacity of our emergency department. Another important area there, we also upgraded the X-ray room, one of the X-ray rooms in the Western Isles Hospital. And another important area for us is retinal scanning, particularly for diabetics. And so we invested in another new retinal scanner for them. You may have heard that we're going to have an MRI scanner in the Western Isles Hospital, and that's scheduled for becoming a reality in maybe in the spring to the summer of 2026. It's more likely probably to be the summer. Construction work on that site is about to start quite soon. It's about, I think, around about a £5 million or thereabouts investment. It will mean that people that need MRI, I'm quite confident, will then get that investigation much quicker than they would if they had to go elsewhere. And for anybody that requires it as part of an urgent care pathway, they will get access to it as well. So MRI is the biggest thing that's coming along in the foreseeable future for facilities at the Western Isles Hospital. Just before I finish, Jill mentioned, performance and celebrating successes, and there are a lot every year, in fact, and I don't want to try and cover them all, but I do want to sort of single one out. The radiographers and the CT cardiac radiographers during this period, they received 3 national awards for their work in cardiac CT. They got the Scottish Team of the Year award, and then actually they got the UK Team of the Year award. And then to top it off, they got the Patient's Choice Award for exceptional care. So I did want to single that one out of all of the achievements that staff have made, which there have been, as I say, many. Training we covered, we do train regularly. There is a huge variety of mandatory training that staff have to undertake so that they can deliver safe and effective care to you, and we've made good progress on that. We do want our staff to be competent, confident and comfortable in what they're doing, so we spend an awful lot of time on training. And I touched earlier on mental health and mental health support, and suicide prevention is important to us. So we had during that period 120 people from across the communities that were trained in applied suicide intervention skills training known as ASSIST training. So it's really, really important our staff achieve, it's important that they're trained, and it's important that we concentrate on their well-being, as we've said we now do increasingly. And that's me. I'm going to close at that, and I'll hand you back to the chair to carry on. Thanks.
Thank you, Gordon. I'd like to ask the audience if there are any questions that they would like to pose for myself or Gordon. No? Okay, thank you. As I said early on, any written questions will be responded to in the appropriate time frame. What I'd like to just do now is just give a wee summary of our performance today. I hope today we've been able to see achievements that we've managed to do. I hope you've been able to look at the performance that we've done, and actually there are some things that we have become very good at. There are still some areas where we have to move, and that's fine because we never stand still, and it's important that we acknowledge that there are things and work that we still need to do. I think going forward, in terms of NHS Western Isles, it's fair to say that the prevention agenda and preventing ill health in individuals is going to be a critical factor in the next decade. More people live in ill health than they live being well, and that cannot be something that the whole of Scotland can allow to continue. So there's going to be some real changes in terms of our strategic direction, notwithstanding that all the core services that we deliver will still be there. I'd like to also acknowledge people who help support our organisation. Gordon mentioned them early on, and you'll have seen some of the celebrations and achievements. They actually are our staff. They are the backbone of what we do. They help support us in every single day, in every activities that we do, not just in terms of the services we provide, but all the services that the Health Board provides and requires to actually do their job. It's also, I'd like to say thanks to the whole of the executive and non-executive team who work cohesively, diligently and professionally to ensure that the services that we provide and the trajectories that are set by Scottish Government are actually monitored and there is assurance against those parameters. I'd also like to thank people that we don't often see, and these are people that support us from the third sector or the voluntary sector. We can't survive without having people who do support the NHS in different areas in which we cannot always give that support. So I'd like to extend a real thank you for those people that we don't see, carers, voluntary services and the third sector who help support what we do. I'd like to thank you all in the auditorium and those of you who are viewing online for your attendance at this meeting today. It is important that the community gets the assurances around what services we deliver. So I'd like to thank you for your attendance today, and I'd like to bring the meeting to a close. Thank you.